So I heard you have questions about post-traumatic stress disorder. What is post-traumatic stress disorder? Post-traumatic stress disorder can be defined as a mental condition that is developed after a traumatic experience or witnessing a traumatic event. Post-traumatic stress disorder is diagnosed only after a month of experiencing symptoms, the symptoms being too intense to go on with life, and or the symptoms interfere with your daily routine. History of the disorder. In 1980, PTSD, or post-traumatic stress disorder, was officially added to the third volume of the DSM. This was added to the DSM due to research on Vietnam War veterans, Holocaust survivors, sexual abuse survivors, and others. The American Civil War in 1861 to 1865 and the Franco-Prussian War from 1870 to 1871 marked the start of formal medical attempts to address the problems of military veterans exposed to combat. We know now today that they were experiencing PTSD. Joseph Leopold, or an Austrian physician, described soldiers experiencing nostalgia in 1761 due to reports of sleep problems, sadness, anxiety, and homesickness. Symptoms of PTSD. Symptoms of PTSD of adults may include flashbacks or reliving the event unwantedly, unwanted memories recurring at random times or due to a stressor, nightmares or reliving the traumatic event through your dreams, severe anxiety, uncontrollable thoughts about the traumatizing event, emotional distress and or physical responses due to something that reminds you of the traumatizing event, avoiding thinking and or talking about the event or places, activities, or people that may have the possibility of reminding you of the event, quick changes in moods, difficulty maintaining close relationships, hopelessness about the future, negative thoughts about you and or the world around you, memory problems or blocking out important aspects of the event, feeling detached from family or friends, lack of interest, difficulty feeling positive emotions, feeling emotionally apathetic or numb, easily being startled or frightened, trouble sleeping and concentrating, constantly being on guard, self-destructive behavior such as drinking, driving too quickly, drugs, or etc. Unable to control behavior such as irritability, anger outbursts, aggressive behavior, etc., and overwhelming guilt or shame. Symptoms of PTSD in children may include reenacting the traumatic events through playing with figurines and or toys, and frightening dreams and nightmares. PTSD symptoms may appear more often when you are stressed or when you come across reminders of the traumatic event. If these symptoms occur for over a month, are too intense, or you struggle to maintain normal routine, talk to a doctor. Causes of PTSD. What might cause or make more likely to develop PTSD is a traumatic event. Traumatic events may include sexual violence, actual and or threatened death, serious injury, intense or long-lasting trauma, trauma early on in life, such as childhood abuse, jobs that increase risk of exposure to traumatic events, such as first responders to a scene or firefighters, combat exposure, such as military, physical assault, being threatened with a weapon, an accident, vehicle, or aircraft, extreme life-threatening events, having other mental health problems such as anxiety or depression, problems with substance abuse such as drugs or drinking, lack of a solid support system in family or friends, and having blood relatives with mental health problems such as anxiety or depression. Doctors do not have a direct cause of PTSD other than that it is probably a mix of the following: stressful experiences, inherited mental health risks, inherited features of your personality, the way your brain regulates the chemicals and hormones your body is to release in response to stress. Anybody can develop PTSD, but women are more likely to develop PTSD than men are, and genes also have a part in the development of PTSD. You can develop PTSD from a friend or family member experiencing danger. It is not likely to develop PTSD from stressors such as divorce, failure, rejection, serious illness, or financial reverses due to the fact that these are typical life occurrences.
Seriously, come on, man.
Oh my goodness. The difference between traumatic and other stressors is based on the assumption that after the traumatic event, the ability to cope with the traumatic event is not existent, and adaptive capacities are overwhelmed when confronted by the stressor. There are some instances in which you are exposed to a traumatic event or stressor, and you do not develop PTSD. Moving on. Treatments of PTSD. Treatments of PTSD. Many people display symptoms of PTSD soon after a traumatic event. This does not mean that they have PTSD. Resilience factors are factors that can help reduce the development of PTSD. Some resilience factors include seeking support from others such as friends, family, or professional help immediately after a traumatic event. Finding a support group after a traumatic event, learning to feel good about your own actions in a stressful event, having a positive coping strategy as opposed to turning to bad habits, and being able to act and respond well despite feeling fear. The main treatments for PTSD are medication and psychotherapy, which is talk therapy, which is basically just talking your feelings out. Every person is different, so treatments may respond differently to a different person. They may work on one person, they may not work on another. Medications for PTSD that are the most studied and effective are antidepressants, which help control anger, sadness, worry, and feeling numb inside. Other medications may be used for symptoms of PTSD, such as insomnia or sleep problems and or nightmares. Effects of PTSD. Some effects of PTSD include difficulty to maintain relationships, isolation out of fear, and difficulty to maintain a job. Stigma. Typically, in this society, people with PTSD are not frowned upon. In fact, they are respected more than others. Case study. Linda was only 26 years old when she was diagnosed with PTSD. It was traumatic. The reason that she was diagnosed with PTSD is because she was experiencing symptoms of PTSD due to she had been raped violently 2 times, once at age 15 and once at age 22, and she had experienced 8 deaths of friends between the ages of 16 and 18. And after psychotherapy and medication for about a month, Linda was observed to be feeling better. And that concludes this presentation.